So I am so excited to have, I call him Dr. Jason, on the show today. And we are going to have a conversation about piggybacking HRT with GLP-1s. So Dr. Jason, tell us a little bit about what you do and your clinic.
Yeah, so I'm a vascular surgeon and now I run basically a functional medicine clinic, regenerative medicine clinic, and gotten into a special interest with men's health now as well. So we do anything from HRT to weight loss, gut health, stem cell work for injuries, recovery, degenerative diseases. And now we're kind of focusing on total transformational health. So we're looking at a lot of granular things, doing metabolic analysis, we're doing genetic analysis, and then putting all that together to develop total health plans for patients at root cause sort of level. So we're getting pretty granular with everything. So
Amazing.
it's been
What age bracket are your patients?
so anywhere, I mean, I would say in general between like 40 and 65. Yeah,
Yeah, but we're
that's
starting to
kind of.
see people get into functional medicine now in their 30s to kind of be more preventative so we don't have to turn to some of these other things
Yeah,
lately.
I think one of the challenges that I've seen with the younger patients is because they don't have any problems yet, a lot of
Yeah.
them, it's hard to get them to buy into the preventative longevity side, a little bit challenging, but like so when I treat older patients, they'll end up bringing their younger kids in and
Yep.
so yes, I have been able to get more of those patients and it's great. It's going to be great to follow them over the long term and see how their health transforms and how they don't develop, chronic diseases and things like that if you can get it early on.
That's
Yeah.
exactly what I've seen with my coaching clients is that the doctors bring the older patients to me and say, hey, I want you to do this kind of coaching with them. I start coaching them, and then they bring their 30 and 40-year-old children
Yeah.
with them to one of their appointments. And then the 30 or 40-year-old children they'll literally say, I don't want to end up like my parents. And that's actually
Right.
how I got into functional medicine was I have two overweight parents. My mother really suffered at the end of her life. She passed away about a year before COVID, but I remember vividly when she started menopause and every doctor telling her, this is just how it is. And I remember, and then I hit menopause a year ago and I was like, I remember them telling my mom this is not how it's going to
Yeah.
be for me. And so
Yeah.
I had already had a hormone doctor. I had a neurotransmitter disorder. So I was already seeing him. And I
Okay.
just said, look, I gained 8 pounds in less than 3 weeks. I was only eating 1,600 calories. What do we do? And he's like, we got to start with your hormones first. And we have GLP-1s. And now you guys have so many tools in your toolbox that my mom didn't have when she hit menopause many years ago. So
Oh yeah.
tell us about those tools and what you use.
Yeah, so we're doing a lot of different things. So, and I know you and I have talked outside, but of course we use, body composition scanning, and now we've incorporated breath analysis work. So at rest and exercise. So we're getting a lot of granular information around like cardiovascular health, pulmonary health, breathing patterns, and then extrapolating that into how much fat they're burning at rest, how much carbs they're burning at rest, how is that changing with exercise, and then what's their VO2 max, and how can we do lifestyle strategies and diet and exercise and some supplementation and improve that. And so getting to those root metabolic, getting that metabolic information is so important. And then now incorporating the genetics. So we're looking at 146 SNPs, single nucleotide polymorphisms, and then using that information, then integrate into the metabolic health that we're doing, and then developing comprehensive programs around that. And of course, we're using the GLPs, HRT, things like that to intervene as well to get down, on those pieces of the puzzle, making sure those things are optimized as well.
So when you're
Yeah.
treating those perimenopausal, menopausal women, you start working with them and they come in and they're miserable. And
Yeah.
we obviously want them to do lifestyle intervention. And that's why people use coaches. A lot of doctors use coaches like me because
Sure.
they just don't have enough staff. But when you start working with those perimenopausal and menopausal women, do you work on the hormone side of it and offer them the GLP-1s, or do you use the GLP-1s as a last resort?
So I kind of leave it up to the patient. And some I educate them on the benefits of both. And I think they're both very complementary. And not every woman that's coming in perimenopausal needs weight loss,
Mm-mm.
obviously, but we can talk more about the long-term health benefits of GLPs anyways.
Yes.
But yeah, so I give them the information and I do tell them, like, as a springboard, as we're getting your hormones in check, like we can springboard your weight loss with the GLPs because it takes, several months for the hormones to actually take full effect. So, but I look at that as very complementary. Some women don't want to be on the GLPs and they just want to go down the hormone route. And some women just really prefer to be on GLPs and
Yeah.
not do the
They're a
hormones.
little bit looking for the quick fix though, and they don't
Yeah, some of them
understand
are
if they
looking
don't
for quick
fix
fix.
all
I
of this,
try,
that's not going to work. But
yeah, and I really, even if they don't want to go on the hormones, like I really still counsel them that there has to be lifestyle changes and,
yeah.
things if you want to get the maximal sustainable effects from the GLPs. So yeah, not so I guess bottom line is I kind of tailor it to the patient, right?
Yeah. What are the
Um,
benefits? What other benefits have you seen in your GLP-1s? What were the other benefits that you had
oh
mentioned
man, I
earlier?
mean, it's been crazy. So I've had people's arthritis go away with GLPs. I've seen people stop smoking. I've seen people
Me too.
stop drinking.
Me too.
I've seen
I've had
brain,
clients stop gambling because of them.
yeah. I haven't had that, but that would be great. And then I've had people's brain fog like completely go away, sleep improve. Like it's almost like they're getting benefits of hormones with a different medication sometimes.
It's been
Yeah.
amazing. I've seen it mostly with tirzepatide,
Hmm.
far more with tirzepatide than semaglutide, but I've seen the same benefits. And I've also seen far less side effects from tirzepatide than semaglutide. And so this leads me to a conversation with you about what does the future of GLP-1s look like? I, as a coach, not a doctor, really see so many benefits of keeping our clients that don't need them for weight management and need them for the brain fog, the sleep improvement,
Yeah.
the anti-inflammatory effects on them. Right now they're really only FDA approved for weight loss or type 2 diabetes. But what
Right.
does this mean for the future? I've also seen them really help with clients with dementia and things like that, or some memory issues as well.
Yeah.
Do we see the future as being able to use GLP-1s for a lot of
Yeah.
these other purposes?
The short answer is I believe yes. I was just at a conference up in Monterey, and there were two obesity specialists that went over all the data around GLPs and all the health benefits that are being seen from them now. And the feeling now is like almost that like the GLPs are like almost the biggest breakthrough in medicine since penicillin.
I've heard
Um,
that. You're the third
yeah,
doctor that's been on my podcast that has said that.
yeah. Yeah, and if you start looking at the studies, I mean, the decrease in cardiovascular risk, strokes, heart attacks, decrease in renal dysfunction,
Fatty
improvement in
liver
cognitive,
disease.
yeah, yeah, and the liver disease, yeah. So the non-alcoholic liver disease is also improving. So now that I mean, I think the trend is going to go that people should be if they do start them, there's a benefit of them staying on them forever,
And how do you
essentially.
feel about, like, I've always said the doctors I work with are big, strong believers in letting people use them in maintenance, very small
Mm-hmm.
maintenance doses the rest of their lives. And they even say, you take blood pressure medication or insulin the rest of your life. Why can't you take a GLP-1 the rest of your life? Do you feel the
Right.
same way, or do you think we need to wean these patients off?
I kind of look at I give them the information and I'm now actually counseling them on staying on them. I don't know what the proper regimen is. There's no protocols out there of
Oh,
how to wean patients. Like if they are going to stay on and it's not for the weight loss, like what's the dose for that? Like I don't know. So I personally am kind of trying some things with my patients and
yeah.
just seeing how it's going to go for them. And I'm just trying different protocols and trying to dial that in.
Well, I
What I
think it's going to
have
be
been,
very patient specific, because I'll tell you, we can start one client on 2.5 milligrams of tirzepatide and they lose weight in 2 weeks.
yeah,
Then you can try somebody else and it takes us all the way to 7.5 until they start losing. And these are people that are the same size. So the
yeah,
way that the bodies are responding to GLP-1s is totally different person to person. So I think, to your point, we're going to have to experiment person to person to see if we can
yeah.
titrate people off of them entirely, or if they're going to need maintenance dosages and what those maintenance dosages are going to look like.
Yeah, and what are you doing the maintenance dosage for too? Because if you're going to do it for long-term health, like what is like there's been some evidence out there about microdosing and about fifth the dose of the weight loss, but that's all relatively in its infancy, and it'll be interesting to see how that plays out going forward. But you're right, and it's interesting if you look at the studies too. The mean body weight loss is what about 21%
Yeah,
on Tirzepatide and 17 for semaglutide. But if you look at the ends of the bell curve, there are people that only lose, 10%, 11% of their body weight and then there's people that lose 50, 60% of their body weight. So there is a huge variation on how the patients are responding. And look forward maybe at some point where we could actually predict the patients that will respond better. But I do know that more obese patients tend to respond much quicker up front, at least in my
agreed.
practice. I don't know if
I've
you've
seen the
seen
same
that,
thing.
but that's what I've seen. So I'll have like a 300-pound patient come in, I'll start them on 2.5, and they'll come back the next week and have lost like 9 pounds.
Yeah.
Like,
But
which,
they're also, when they're 300 pounds, they have so much inflammation
well,
that some
exactly.
of that's,
So,
I know you use a BIA scanner, so you know that it's body fat versus inflammation.
oh,
But that was
yep.
the most mind blowing for me because I own the same body scanner. And
Yes.
I started scanning myself and so I take tirzepatide in low dosages. I'm on a maintenance dose every 30 days, 5 milligrams every 30 days.
Yeah.
And it's been perfect doing it that way. But
Right.
I scanned myself as well as many of my clients, and the reduction in inflammation in the first 30 days was the most mind-blowing. I've never seen any type of supplement, drug, anything we've ever given to my
Yeah.
coaching clients that they've had that big of a reduction in inflammation that quickly. And it was
And I
mind-blowing.
think that's where we're seeing a lot of the long-term health benefits is that decreased metabolic inflammation that goes along with insulin resistance. And that's why I think it's so complementary with the HRT,
Yes.
because as they're losing weight, as the inflammation's going to go down, it's going to allow the hormones, one, to respond better to them, have a better response to the hormones. So it's very complementary. And then like for guys, as they lose weight, they're going to lose that estrogen response too. So there's a lot of estrogen that's stored in fat. So that's going to also help optimize their hormone levels. And then if we can counsel them properly when they're on GLPs about increased protein intake and resistance training, as they build more lean body mass and lose the fat, their insulin sensitivity is going to naturally get better. They're going to build that lean body mass, which is going to improve their metabolic rate. And also in guys, it's going to help produce more testosterone. So, there's a lot of benefits of doing the two together.
And
So,
I think you touched on something. It's amazing because I just spoke to Pete McCall, who's a educator in the fitness industry and has written some books on longevity and talks about this need to get our clients resistance training. I don't know if you've experienced this. It's a little off topic, but I'm going to bring it up since you brought it
yeah,
up because I totally agree with you. It is so intimidating for a lot of our GLP-1 weight loss clients to even pick up a weight. They've never even walked a day in their lives.
I
So do
know.
you have any like little tips or tricks to try to get these people to start lifting some weights, or if you could
Yeah.
give them one word of advice, what would it be?
So I always try to meet patients where they're at, and you're
Me
right.
too.
So a lot of these patients that are coming in have not done any physical activity at all.
What would you
So
say the
telling them, oh,
percentage? What do you think the percentage of your patients that have done no physical activity are coming in for GLP-1s?
probably like 70%.
Mine are at least 70%. I agree with
Yeah,
that number. Yeah.
something like that. Yeah. So I'll counsel them, and I try to break it down and make it like give them like the first step. So like almost to the point where like just put on your gym shoes. Like, try that for a minute and see, and maybe the next time you put on your gym shoes, go out for a walk, and just, trying to coach them. You're a coach, so
Yeah.
there's psychology and the little wins around this. So when it comes to the resistance training, I just don't like anything. Like if you have resistance bands at home, just do that for
Grab
and it
five
only
pound
takes
weights
about
when you go for your
yeah
walk. Do
yeah
anything.
or a milk jug. I mean anything,
Yeah.
like just do something so you start the resistance part of it
What
because
Pete does, which I was brilliant yesterday, he told me this. He has them put a backpack on and put a book in their backpack the first time they go
yeah
for a walk. And then a week later, you put 2 books in your backpack.
yeah
And then you put 3 books in your backpack. I was like, I don't know how I never thought of that because he and I come
yeah
from
that's
the
great.
same coaching background. I was like,
Yeah,
that's so brilliant. You just made a rucksack out of like your kid's backpack that they're not using. It's brilliant.
yeah, that's amazing. Yeah, so little things like that. So I try to keep them motivated, and I think the body scanning, the body comp really helps because if they come in and their lean body mass is dropping, and I've counseled them up front on the importance of resistance training and nutrition and high protein, and their lean body, they come in, their lean body mass is dropping. I'll ask them like, have you been doing any resistance training? How's your protein? Oh, I haven't been, taking that much protein.
Yep.
Oh, I haven't done any resistance. I said, well, this is what's happening. Okay, so, and then I just educate them on, we'd like to see the trend going the other way, or at least not 50% muscle and 50%
Yep.
body fat, like at least 75% fat and 25% lean body. I mean, because you will lose some if you're not careful.
We're going to
But
lose some lean body mass anyway.
yeah,
And most of our
yeah.
obese clients have surplus muscle anyway,
Oh,
just from carrying all that
absolutely.
weight.
Yeah, yeah. So yeah, I mean, it's just that. It's just really trying to counsel them on the
I always
little
tell people I
things.
love it when I get a bad body scan on my client. I don't want perfect body scans every time I scan a client because then there's no teachable moment. So I
Right.
love it when I get a bad body scan on my clients, and they happen, every 3 months. People drop off, they get a little lazy, they are
Hmm.
uninspired with their nutrition, or they get really busy at work and they don't exercise. I love having bad body scans. Great body scans, there's no conversation. I can just tell them,
Right.
good job, high five, let's go. But if
Yeah.
I get a bad body scan, that's the teachable moment. I go right back to those 5 building blocks of health and wellness. And the first question is, how has your stress been? And they're like, oh, stress has been terrible. My kid's been sick. Oh,
Right.
can't avoid stress, but you got to find a way to mitigate or manage that stress. And then,
Yeah.
how is your sleep been? Oh, my sleep's been terrible. I send them right back to the HRT doctor. That's the very first thing I do is I say, you
Yeah.
got to go back to the doctor because Dr. Jason's going to help you with that.
Yeah.
And if you haven't told him that your sleep is disrupted, what are you thinking? Like, you got to have communication both ways. And then the third one is I talk to them about their hydration, especially on GLP-1s. They make you so dry. You got to get
Hmm.
that 3 liters of water. And just as a little bit of an aside, 90% of the side effects from your GLP-1s come from not drinking enough water and
Yeah.
not eating. And so if
Yeah.
I can get 3 liters of water down them every day, they don't have constipation, they don't have an upset stomach, they don't have the hair loss. So those are going to
Right.
be some of those things as well. And then the healthy nutrition, they've got to have a healthy fat, fruit or vegetables. So they have their fiber and they've got to eat
Hmm.
protein 3 or 4 meals a day. And then we got to get them out walking and resistance training. So I love having those bad scans because those are my
Yeah.
teachable moments. Are you
Absolutely.
using coaches in your practice? Or are you really doing a lot of the coaching yourself?
I've gotten very much into coaching. I really
It's fun,
enjoy it
isn't it?
myself. Yeah, I find it very rewarding to have those conversations and be the accountability partner. And so I like the fact now that I'm combining the medical with the coaching, and I feel like it connects me with the patients more too.
Yep.
And they trust me more because I'm not just a doctor that's telling, oh, go do this, do this. I'm actually developing plans for them, and it's been really great.
It's so
So
fun. My HRT doctors will call me and ask me for, like, well, Sharon, do you think I need to raise their tirzepatide, or you want me to keep it where it's at? They'll ask me and
oh,
I'll
really?
say, yeah. And it's funny because you get such an intimate relationship with people when you coach them. And I'll always say, this is the trend that I've seen. This is what the data is showing me. And this is what they are personally telling me. Because they'll tell
Right.
me things that they don't always tell their doctor. And so,
Right.
and I take copious notes and I'll send my coaching notes to the doctors and they add it to the medical record. But
Hmm.
I just got so lucky that I was already working with the HRT doctors on the coaching side when GLP-1s became popular
Yeah, that's
because,
very fortunate.
yeah, they walked me right in, which was amazing. I got
So
really
what percentage of your patients are on HRT that would you say they're on GLPs? I mean, is it
75%. So I have some
okay?
that are young, and so they're GLP-1 only, but I've also found the young ones that are GLP-1 only patients really can't even afford a year's worth. So it's not really worth us putting them on it. I have very strict conversations with them up front that say, this is a minimum of a 1 year commitment. And that's what the data is telling us. Like when we look at the
Hmm.
tirzepatide data, 90% of the weight loss happened over a 1 year period. And
Yeah, it was 1 year.
it was at the end of the year. So we know if people stick with it, they'll hit their weight loss. But this is not a 3 month quick fix magic shot, which is like, I feel like the people that are selling that, they're just selling it to make a dime. But when I coach, I really talk about that up front of like, this is a 1 year commitment. Make sure you have your budget in order, but you're going to save money on eating out. You can't drink alcohol while you're on them. So you're going to save money while you're eating out and drinking alcohol. And that will pay for your monthly GLP-1s. So I
Right.
have some young ones that come to me. Now, I do have some young ones that have PCOS, undiagnosed PCOS since they were 12 years old, and they're now 18, and they walked right into their gynecologist's office and said, I don't want to be like this anymore. I watch what I eat. I do eat healthy. And what's really interesting to see now is that the traditional gynecologists are not saying calories in and calories out anymore. And they did up until 3 or 4 years ago. So we know that GLP-1s have helped change the narrative around the way we treat obesity
Right.
patients. And I love that because now the research is coming out that there's probably a good chance that they have insulin resistant PCOS. And now these
Hmm.
doctors are looking into that, fibromyalgia, Hashimoto's, where they weren't looking at that prior to GLP-1. So now I would say most of my clients now, 75% are perimenopausal, menopausal, even some in their late 30s are still perimenopausal. So they're piggybacking HRT with GLP-1s. Then I have this younger group that 25% are not piggybacking HRT, except even in some of the younger ones, we found that their testosterone, even in women, the male testosterone is unbelievably low
Oh
in
yeah.
that 25%. And the free testosterone in the women of that age group is incredibly low, well below average or normal.
Yeah. Yeah. I think that's great. I mean, the hormone piece is so important and it's often ignored. And that's what makes it really frustrating about the patients that come from the med spas and they're getting their GLPs $199 a month, and there's like no counseling, there's no, health intake,
Mm-mm.
there's nothing, and then they come in and they're like, I'm not doing well on these. I don't feel good. Like, and they've lost a bunch of muscle by the time you scan
Yeah.
them. And and it really hurts the public's perception of the GLPs too, which I don't
I also
like.
think a little bit of it is the consumer. I'll beat up the consumer a little bit. They go onto Groupon and they're looking for these
Oh yeah.
$49.99 deals from these telemedicine companies. Now, I work for a telemedicine company who I dearly love and adore, and I'm a coach for them. And every single one of their patients is given coaching and it's included in
Yeah.
the price of their medication. And they do not mark up the cost of the medication for the coaching. It's all included, which is very rare. But I do feel like there's enough about GLP-1s in the news today that you as a patient should not be thinking that I'm just going to take a shot and lose weight. That
Right.
I think that the consumer going on to Groupon and trying to get deals on medication coming from compounding pharmacies is a really bad idea.
Oh, absolutely. Absolutely. But that's a whole different topic about the psychology of the consumers and the
Yeah.
quick, instant gratification mentality of our culture. And so, yeah, I like, as you do, like working with the patients that are really committed to kind of transforming their overall health,
Yeah.
and using GLPs as a treatment to help with that.
And including the lifestyle intervention piece. And
Yes.
you and I talk about lifestyle intervention all the time. We go to all the conferences and talk about
Yeah.
lifestyle intervention. Lifestyle intervention is so important. GLP-1s are not going to solve the majority of your problems if you don't do the lifestyle intervention piece. And
Yeah.
my patients come to me saying, I don't need to improve my sleep. And then they get on GLP-1s and then they come back to me and say, you were right about the lifestyle intervention piece. I was wrong. And I love hearing that because once they just start just chipping away, they don't need to make big, like you were saying, meet them where they're at. It's those small wins. Once they start making small win after small win after small win, they want bigger wins and bigger wins. And they are less
Right.
about weight loss and more about longevity the longer I
Hmm.
get to work with them, which is my love language.
So,
And I think the GLP-1s for me, the biggest takeaway for me from GLP-1s is the psychology of weight loss. We stopped for the first time in my career. I've been a weight loss coach for 30 years. And the first time in my history of my profession, we stopped blaming the client. So people say, and that's why I get so angry, why I work in the medical industry and I don't work in traditional fitness industry anymore, because I got so angry with how dogmatic these coaches are, like Jillian Michaels, that are spreading all of this misinformation about GLP-1s, when if they would just embrace it, we could help 43 to 48% of the adult population in America is clinically obese, BMI of over 30, and 99% of them are over fat. 1% of it, less than 1% are over muscle. So we know that we have a massive obesity epidemic. And if we would all just work together, we could change the stigma and the way we treated people and help so many more people lose weight if we all got together.
Absolutely. And I just want to comment on the BMI piece of that, because BMI is so outdated now. BMI does not, so body composition is actually a better predictor of health than actually BMI.
100%.
And so everybody's still, most people still rely on BMI. Well, BMI was developed when there wasn't technology to look at body composition, right? So that's the best we had. So, so my point is there's probably even more people that could benefit from GLPs, because even though they may even be normal weight with a normal BMI, their body comp may not be ideal for longevity, meaning that their body fat content is too high, so their normal weight obesity. And so those are the people that are even further overlooked and develop chronic long-term problems because I'm skinny, I'm fine, my BMI is fine. Well, no, maybe it's not fine.
No, and it is not
25.
fine. I will tell you, I have clients that come to me, they know that they are fat. They'll say to me, I am fat. I can look at them. They are fat. And their BMI is not over 30. And they have no and no other health underlying health conditions. So I can't even get doctors to prescribe them because doctors are so afraid to use GLP-1s right now off label because there's so much pressure on them. So, but I can look at the client. I know I don't even have to put them on the body scanner. I know their body fat before I put them on a body scanner. Then I put them on a body scanner and they're like, I really want a GLP-1. Now I have some doctors that I'll shoot them to, like you and Dr. Lester Lee, and those that are using GLP-1s off label. They don't care. They're like, I want to help people. So I push them out to you guys. But really, if most people with a normal BMI, it's going to be very hard to find a doctor that will prescribe them their GLP-1s. And it's a massive missed opportunity for longevity and just basic health.
Yeah. Well, and I think because a lot of those people with the normal BMIs that need those lifestyle changes too. And most doctors don't want to deal with that either.
No.
And so, you want to help them build the lean body mass. You want them to, make the diet changes to help, because a lot of them may have normal BMIs and their visceral fat may be, through the roof, or their A1C level may be like 5.7 or 5.8, but their normal weight. And
but we have doctors that are getting A1Cs that are pre-diabetic and telling their patients that their blood work looks fine because and I'm like, your blood work doesn't look fine. You're pre-diabetic. And the doctor says, oh, that's fine for me at my age. I'm like, no, it's not fine. You need to go. Here's the name of 15 other doctors. I would love you to go get a second opinion. And it's so frustrating for me as a health coach because A1C is something that we're looking at with all of our clients today. And when they say, oh no, my doctor says my blood work is fine. And I look at it and they're pre-diabetic. I'm like, you are pre-diabetic. We could fix this now without a GLP-1, without insulin, without anything. By the time you become diabetic, it is too late for me to help you. So we got to do it now.
Well, even further, I had a patient the other day who had a hemoglobin A1C of 6.9 or almost, I think it may have been 7. And I said, well, what are they doing? Are they going to treat you? They said, no, my doctor told me he's going to wait till my hemoglobin A1C goes up to 7.5 before they do anything for me.
And they're not even recommending lifestyle intervention.
Nothing,
like that's what's
nothing.
even
They
crazy.
said, they told you to do nothing, just wait. I'm like, that is not okay. I said,
not okay.
Ridiculous.
Yeah, it's not okay. And then the other one is they're going to give them insulin, which then is going to make their obesity problem worse. And it's going to make them more insulin dependent. They're not going to give them a GLP-1 because the insurance companies are still not paying for it. So we have to wait until you become so insulin dependent that we have to give you insulin, which is going to make you more insulin dependent, which is going to make it nearly impossible for me to reverse your type 2 diabetes. And that's so frustrating for me as a coach and somebody who's really dedicated my life to this, my adult life to this. And I'm like, I get no help from those doctors. And you know this, traditional medicine takes your insurance. Typically, doctors like yourself, it's too difficult for you to take insurance for what you do. And it costs these patients quite a lot of money, except their labs are still run through their insurance and stuff. I'm telling you, If you are not well, if you don't feel well as a patient, you need to search out doctors like Dr. Jason because, and even though you got to pay out of pocket, you got to do it because it will save you money through your long-term medical costs if somebody catches it early. Traditional doctors are going to say, your blood work looks fine, everything's fine. If you don't feel right, it's not fine. You know, there's
Right.
something going on and they don't know what to look for. And I suffered from that for 5 years before I competed in bodybuilding, in fitness. And it wasn't until I prepped for a competition and I got super, super low body weight, body fat. I was like 8% body fat to step on stage right after we had my blood work run just coincidentally, and we saw it all. But had my body not gone through the stress of competing, we would have never seen it. And doctors would have kept telling me I was normal and I wasn't normal. And I knew I
Yeah.
wasn't. I knew
Well,
I wasn't normal from the age of 12 years old. I knew I wasn't.
yeah. Well, I had the same experience, and I think all of us in this space, or a lot of us in this space, have our own personal connection with health and wellness and our own stories. So, I was at one point back in 2016, like 240 pounds. I was pre-diabetic. I was on 7 medications.
And you're a doctor.
Um, and I was a doctor. Well, I was in finishing, well, I wasn't attending at that point, but I was working like 120 hours a week. I was not taking care of myself at all. But my doctors did no coaching with me. They did nothing, and it wasn't until I went to a nurse practitioner who at that point, I guess she even called herself like an integrative nurse practitioner, which back then wasn't that common. She got me on track and like I was able to get off all of my medications. I'm not insulin dependent or I'm not insulin resistant anymore. I had thyroid Hashimoto's. I don't have that anymore. But it wasn't through any help of any traditional healthcare system. I can tell you that much.
No. And I will tell you with my Hashimoto's and my fibromyalgia clients, 9 times out of 10, they're misdiagnosed.
Yeah.
And because they're going to a traditional endocrinologist because they don't want to spend the money to see a doctor like yourself. And even if they do have Hashimoto's, the way we're treating Hashimoto's, again, I can give a GLP-1 to a Hashimoto's patient and they are far more successful than the traditional Hashimoto's medications that they're taking.
Well, Hashimoto's is usually just a symptom of something else going on in the body.
Correct.
And a lot of times it's from the gut, but but the
Which
GLP-1s can
we have
definitely.
other peptides that can help. I won't go down that
Yeah.
rabbit hole because you and I can
Yeah,
talk
exactly.
peptides and all of
Exactly.
that till the cows come home. And I'm so passionate about it. But so Dr. Jason, if you had one word of advice to give the people that watch our podcast as it comes to HRT and GLP-1s, what would it be?
I think I would echo what you say. So, patients, you know your bodies. When you go to your doctor and you tell them you're not feeling well, and they say, "Oh, you're just depressed," or
Oh, it's all
you're
in your
just
head.
aging. It's all in
Women
your
are told
head.
this more than men, but we are
Yeah,
told that it's
yeah,
all in our heads.
yeah. Men, though, because I have a men's clinic, I see it from the guys all the time. They
Yeah.
come in and they're tell their doctors they don't feel well. They're gaining weight. They're not sleeping well. They're grumpy, and their doctor says, "Oh, you're depressed." They put them on antidepressant and they send them on their way.
And
So
then
if
all the antidepressant does is make them stop caring that they're fat.
Exactly. It just numbs them to
Yeah.
everything. And they also get the side effects and even the sexual side effects, which just makes everything like way
Much
worse.
worse. And that's for
But
men and women. Both have
yeah,
those same cascade of side effects that is
yeah,
not fun.
yeah. So, if you feel that something's not right, and you need to find a doctor or a health coach or somebody that's going to listen to you because you're not crazy.
You're
There's
not crazy.
something not right, and you need to find out what it is and get it in the right direction before things get so bad that now you have this chronic health condition. And the other thing I would say is
Oh, wait, one
oftentimes,
thing, and be willing to pay for that. Be
yes, so
willing to
that's where
pay
I was
for
going to
that.
go with that. On the financial side, what I do with my patients, and I try to get them to look at their problem from a different lens financially, because they may come in with a problem that in their mind is a $2,000 problem, but really it's probably like $100,000 problem. Because if it goes on, they're going to not only have more healthcare expenses, they're going to have problems with their job. They may have to miss work, out of work, all the other expenses that come with chronic illness that are on the back end. So when I'm telling them that it's going to be X amount of money, I'm like, this is a fraction of actually what this problem actually is worth to solve. And
Yes.
that's what people need to realize. Like, if you have a problem with your car, it's a transmission. It's better to pay 5 grand to get the transmission fixed than have it blown. You got to buy a whole new car for 50 grand.
Yep.
right? So, but
100%.
so that's where I try to educate them and get them to change their philosophy on what it means to invest in their health. And I think health is one of the best things that you can invest in because it ripples into everything, whether it's relationships, your business, your
Your
activity
children.
level, leisure, and
We,
your children.
you and I deal with a lot of moms and dads too,
Yeah.
because of our age demographic. If you take better care of yourself, your children will learn to take better care of themselves.
Yeah. And always put your oxygen mask on first, right?
Yes.
I mean,
Yeah, 100%. I always tell people if you don't advocate for yourself, your children are not going to advocate when they become adults. But if they see you, especially moms, don't advocate for themselves. I feel like my male clients advocate a lot better than my female clients do. But if you do not advocate for yourself, your children aren't going to learn that.
absolutely. Yeah, it starts in the home.
It does. Everything starts in the home, the way we eat, the
Everybody
way we
starts in the
sleep, the way
home.
we drink, everything. Well, Dr.
Yeah.
Jason, thank you
Yeah.
so much for joining me. I really
Yeah.
appreciate it. And we'll
Well, thank
chat
you for having
soon.
me.